So we've prepped, we've smoothed our prepped, we've impressioned or scanned it for scanning. Now it's time to provisionalize. And there are 3 keys to a provisional that follows what I'm teaching. Provisionals should be biologic in nature, they should stick pretty well, and they should be relatively aesthetic. Most importantly, they need to fit. So the old days, we don't see this much today, but years ago, I used to see pictures when dentists used to post what I used to call the garbage cans. They were like aluminum type crowns they would just shove over the preparation that would never ever come close to fitting around the margins of the tissue. And then you try to cement a crown and everything's inflamed. We need to have biologic type temporaries today. When we have our preparations completed, we need to create provisionals that are going to look somewhat like the permanent tooth. Again, you have a lot of products to choose from, Clinician's Choice. And I think the theme you're seeing is Clinician's Choice has complete crown and bridge solutions. So this is the Inspire aesthetic provisional material for Clinician's Choice. It's aesthetic, it's strong, and it handles real well. Within their kit, they have something called template, which allows you to take a pre-impression of your preparation. It sets fast in 30 seconds. Notice it's in that metal tray. And then after our prep is complete, we inject our Inspire into the tray and we take it out. And you're going to learn about a polisher tonight that's going to just blow you away, that has totally changed everything we do. These are the ASAP direct polishers that we've polished this provisional with. And these polishers can be used on all your composites to give you a magnificent, magnificent shine. They're diamond impregnated, flexible polishing wheels, and they can be autoclavable about 30 times or more. It doesn't cost you much money. But again, this material will give your provisionals a great shine, but it'll also, they make these as the indirect, ASAP indirect polishers that we'll show you in a little bit, that you can use to polish all your indirect materials. So we've polished it. Now we're cementing the crown with Cling2 cement, which is Clinician's Choice cement. It's an easy cleanup type cement. It peels off the preparation margins in seconds, but its unique chemistry makes it also bacteriostatic and retentive. So we've placed our provisional in place, we've polished it, we've checked the occlusion, and the patient is sent on their way. Again, another case, our veneer preps here are completed. We've smoothed things up, and these are our Inspire provisionals on the patient. We've polished them up with our ASAP polishers. This image was taken with our Shofu iSpecial C3 camera. One of the unique modes in this camera is by pressing a button, I can gray out the soft tissue just to make sure that this looks good. I mean, this looks good for provisional. The tissue is a little beat up. We just prep these teeth and we laser troughed and everything else. But when I take the image after we've polished it with our ASAP polishers and take the Shofu image with my black and white image, this is our provisional. Look at the shine that we got. This case is not even finished. I'm inserting this case in 2 weeks. But look at the shine and polish we got from our ASAP provisional. We've placed a little bit of clear resin on top as well, but the clear resin would never look like that if the shine underneath was not there. I can take you back a slide to show you how shiny this is right here, just with our ASAP all access polishers. It's 2 polishers, a purple and a pinkish tan is all you need to achieve a high shine on any composite material that you use. So we use it for our direct composites, our inlays, our onlays, things like that, to give an ideal shine. And here, once again, we see the shading is on the money. And for provisionals, I think these look pretty okay.